is truly a privilege, and we feel so lucky that they have come to share their stories. So please join me in welcoming them to Harvard Medical School and the space. I would also like to thank Drs. Mark Proctor, John Mira, Rob Sheridan, and Mark Gorman for being here today. As students, we are so deeply inspired by what you choose to do with your time and how you've come to share why you do this work with us today. So from students, thank you so much for coming and sharing. We'd also like to thank Dr. Dean Chang, Dean Saldana, and Dean Daly for meeting with us, for helping us organize this, and for rescheduling this incredibly important patient panel. And of course, to our beloved Dr. David Jones. Where is he? Oh, there you go. Thank you so much for advocating with us for what you did this entire month in our social medicine class, for teaching us about racism in healthcare, and for inspiring us to be better physicians and advocates. We are deeply appreciative of everything you do, and thank you for everything you did to help us organize this properly. So to start off, Brian and Dr. Ansari will give a brief presentation, and Mark and Miriam will introduce Walid. Dr. Tamira and Proctor will also share briefly about Walid's journey, and Noor will introduce Aser and Anas. And you all have their amazing bios and stories that we have shared with you. And Dr. Ansari will continue moderating the panel. So thank you all for being here, sharing your time for this coming hour, and thank you again.
Good evening, everyone. My name is Brian Brewster. I'm a pediatrician and recently finished my training and residency at the Boston Children's Hospital. Very grateful to be here tonight and to share a little bit more about the historical context about what has been happening in Palestine, just to level set and make sure that we all have a shared understanding moving into the panel. And so the emphasis here is on brief. This will be a very high-level summary of the salient events that have been occurring really over the past 100 years that have led to the conflict today. And I will preface this by saying that while we'll be talking about historical events, of course they can be interpreted very differently. So we'll start with the beginning parts of the 20th century during what's called the British Mandate period. The British governed over the Palestinian population while simultaneously facilitating the immigration of over 300,000 Jewish people. This was an attempt to honor something called the Balfour Declaration in 1917, which is an agreement that promised the establishment of a national home for the Jewish people. Moving forward to after World War II, the British handed this issue over to the newly established United Nations. The so-called 1947 partition plan attempted to carve out separate Jewish and Palestinian states. And even though the Jewish population constituted only a third of the population, they were granted more than half of the established land. Worsening tensions as a result of this and other factors led to the Arab-Israeli War, which Israel won. In 1949, more than 750,000 Palestinians were displaced from their land. This is remembered as the Nakba, or the catastrophe, as they became stateless. By contrast, Israelis saw this as the start of their independent nation. Ongoing military conflict, including the 1967 Six-Day War and the First Intifada, marked the next 4 decades forming what we know today as the modern state of Israel, Gaza, and the occupied West Bank. You can see the progression of that change in the land over time. In 1994 was held the Oslo Accords, which were a series of talks brokered in part by the United States to set the conditions for governance and peace. However, these negotiations largely stagnated by the beginning part of the 21st century. There were more violent disputes, eventually giving way to the election of Hamas in Gaza, who remains the governing authority through today. Now, the Gaza Strip is just over the size of Detroit and has become a focal point of the Palestine-Israel conflict. In 2007, Israel imposed a land, sea, and air blockade on the region to control militant groups like Hamas. And as a result, the import of quote-unquote dual-use goods, electronics, medical supplies, many other categories of goods that could be potentially used as weapons was heavily restricted. Moreover, the movement of people was limited to two major ports of entry, which you can see on the bottom of top there, with Israel and Egypt. And as we'll discuss more, passage was governed by a permit system and subject to a lengthy bureaucratic process. The lack of stable governance, social and economic growth, and sustained violence really created the conditions for a long-standing humanitarian crisis, even well prior to the events of October 7. Among the population of around 2.3 million, the employment rate was the highest in the world at 49%, poverty rate of 56%, with more than 80% relying on humanitarian aid to survive. The restriction of food imports and other essential items, water, fuel, electricity, has yielded alarming rates of malnutrition. Meanwhile, more than 90% of the water in Gaza is considered unfit for drinking, a major vector of diarrheal and waterborne diseases. In this setting, the healthcare infrastructure in Gaza is understandably fragile and fragmented. The main provider of primary and secondary healthcare is something called the Palestinian Ministry of Health, which has been forced to operate at extremely low levels of capacity due to the regulation of equipment and medications. The Ministry of Health is supported by humanitarian groups like the United Nations Relief and Works Agency, Palestinian Red Crescent Society, and the Palestine Children's Relief Fund. And just of note, since the start of the current conflict, no hospital in Gaza is fully functioning, and half of the remaining facilities are completely out of service. And importantly, what will be the focus for the larger section of tonight is this referral process to receive specialized treatment outside of Gaza. It is imposed by the Israeli state and is, as you can see here, extremely convoluted and restrictive. You can't see the details, but the process involves many steps of review, logistics, with more than a third of cases being denied. This can be even more complicated for children and require approval for a companion or caregiver. This has been extensively studied with a recent work looking at pediatric leukemia, where 100% of patients studied required permits. And with that, I'll pass it along to Mark and Miriam to talk about our star of the show, baby. Thank you, everyone.
Good evening, everybody. Thanks, everybody, for coming. This brings me back to days when I was a student here. And although I am a faculty member tonight, I'm really speaking as more of a private citizen, since my role in Walid's care was really that. And I was not participating directly in his medical care at all. And so I'm here with my wife, Miriam, and we'll try to tell Walid's story. As we got to know Walid, I thought it was really important for me to try to understand his story. And so it took me a long time. There was a lot for me to learn. And so I'll do my best in trying to honor that. Walid was born in Khan Yunis, Gaza in late July 2023. Pregnancy was uncomplicated and he had normal prenatal ultrasounds. However, at birth, it was recognized that Walid had an abnormal head shape. He had a head CT in Gaza that confirmed multi-suture or so-called cloverleaf craniosynostosis, and you'll see some images from Drs. Muir and Proctor what that looks like. So his medical providers in Gaza quickly determined that they were unable to provide the necessary care, and so they applied for a medical permit to travel outside of Gaza. At the time, the medical permit was one of more than 100 different types of permits to try to travel outside of Gaza. This is the same slide that Ryan had showed. I'm not going to go through all the details, but just emphasizes the many steps that it takes in order to get a medical permit. And I'll go through some of the major steps here. Patient's doctor submits a referral form to the Palestinian Ministry of Health. Application is reviewed. If it's medically approved, then it needs to get financial approval. And then the last step is that the Israeli government, through various bodies, needs to approve the permit for the patient, and in the case, particularly of children, of the companion to travel. In this context, in 2019, the WHO made some recommendations to the Israeli government. These included, and these are direct quotes, ending the arbitrary delay and denial of permits for Palestinian patients, and in particular for children, that no child applying for a patient permit with the accompaniment of a parent should be denied the accompaniment. Despite those recommendations in 2019, this is data from the WHO, which shows approval rates for patient permit applications, and you can see even in the ages 0 to 3 range, that the denial rate between 2019 and 2021 was on the order of 25 to 30%. In 2022, WHO looked again, and 29% of medical permits for children were delayed or denied. And beyond that, nearly 2/3 of companion permits were delayed or denied. And there were several cases where children unfortunately died while awaiting their medical permits. So I'm going to finish with this slide and then turn it over to my wife Miriam. So in September 2023, Walid's family went through the medical permit, and his physicians went through the medical permit process. They were able to get approval and financial approval and arrange for admission to a hospital in East Jerusalem. However, his permit with his mother was denied.
As Mark said, I'm his wife Miriam. I also work at Children's Hospital, not in the capacity of physician, but as a clinical coordinator in one of the clinics. But I am also here as just a regular citizen sharing the story of Walid, who we were honored to have in our home for about 8 months. So where Mark left off, Walid's family was denied permits to travel, and it's one of his favorite people, sorry. So it was one of the times that his mother was in the hospital. She heard about an organization called the Palestine Children's Medical Relief Fund that helps get families medical care. So through that other patient, she was able to come in contact with them, and they were able to register with the NGO. And arrangements were made to send Walid to East Jerusalem for surgery. Unfortunately, his parents' permits were denied twice, and then when they applied again, he was allowed to travel with a representative from the NGO, not his family. About 2 weeks before he was supposed to travel, the war broke out, and Walid and his parents had to leave their home and travel to the designated safe zones. His home was destroyed. His family were relocated multiple times, lived in tents, they were displaced, they traveled on foot. Walid was ill many times and did not receive medications because there weren't any. The organization was somehow able to actually find him amongst all of the displaced people, and were able to very, very quickly grant him a permit to travel to Egypt. So his mother was the only one allowed to leave with him, and she had to say goodbye to her family within 24 hours and leave to go to Egypt with Walid. From Egypt, he was brought to the US for care. I know I'm skipping some of that data on these slides, but I just thought I'd kind of let you guys read as I talked. Heal Palestine was the organization that ended up taking over Walid's care when he came. It was a kind of a spin-off from the founder of the PCRF, Steve Silby. And through a representative Noor of Heal, we were able to be in touch with Hiba, and she came to live with us. And basically, he arrived last March. And then, did you want to take over these slides?
This slide just basically shows that, the rate of permit denials was high before the war, but then went even higher after the war. Despite that, Heal has been able to evacuate more than 30 children from Gaza to the U.S. To receive medical care at various institutions. So we first met Walid, I think the first week of March in 2024, and at the time he was 7 months old. He did have a gross motor delay, and he also had failure to thrive due to malnutrition. Towards the end of this part of the presentation, we'll show you his growth curve, which is pretty remarkable. And he had further workup when he came, had a repeat head CT, and then an ophthalmology exam that showed that all were consistent with increased intracranial pressure due to his craniosynostosis. And then just some references for some of the figures and data that we showed. And I'm going to turn it over to the stars of the show. The second stars of the show, Mark and John, who did the hard work. I guess I'll show this now, this, you can see Walid's growth curve here. This is his weight growth curve. And when he came, he was in the 3rd percentile. And as of his last measurements on this curve, he was nicely in the 50th percentile. And I think he's even put on some more weight since then.
Great, thanks. Thanks for the invitation. We really didn't know what to expect, so this is really a phenomenal event, and we're honored. At least I'm honored. I bet John's honored too to be part of this. So I'll sort of talk about the early part. So I'm the neurosurgeon on the team. So craniofacial team is a neurosurgeon and a plastic surgeon, and then it consists of a lot of other practitioners as well, but for the surgical components, it's a neurosurgeon and plastic surgeon. And this is Walid's original scan from shortly after birth there. And what you can see, if you think of our heads, right, they're these nice hard objects, but in babies, they should be soft. There should be 5 major separate bones separated by 6 divisions called sutures, And the rationale for that is that human brains, because they're so much bigger and because we walk on 2 legs and can't carry the pregnancy as long, a lot of our brain growth happens after birth. So it's almost like a balloon inflating. Each day the brain grows a little bit, pushes the bones apart a little bit, and we maintain that shape and that growth pattern over time. But about every 2,000 babies, the bones come out fused together. And most often it's only 2 bones fused together. It's not all of them, it's 2 of them. And the biggest issue is a sort of cosmetic deformity. But once you start getting 2, 3, 4 bones fused together, it's actually a major threat to the brain growth. And even with just 1 suture fused, you can start to have brain growth and development problems. So when you get sort of 5 or 6 or all of them, it could become really a crisis because the brain doesn't have the opportunity to grow. And then you call it a cloverleaf skull simply because some of the forms, if it's very symmetric, looks like a cloverleaf. So this is Walid's early scan, and what you can see are where the divisions between the bones should be. He doesn't have them except for maybe one in the back over there on the right side. And all of those little holes are bony erosions where the brain is eroding through the skull. So it's really a brain that's sort of struggling to grow. And this is just by the time he got to us. So normally, if you'd ask, well, when would you treat that? It would be, within days, weeks to a month or 2 of life, because you don't want the brain to sacrifice as it's struggling to grow. But obviously, for the reasons just outlined, that wasn't feasible. So he was treated really very quickly after he came to us, but it was many months. It was about 6 to 7 months of life. So here you can see now the bones are getting a little bit thicker, but he's still eroding through them. They're all closed off, and the shape is quite different from average. I mean, that's how, in most of these cases, that's how we know that it's a condition. So this is him when he arrived, and what Mark was alluding to in the ophthalmology exam was that when you look, the one part of the brain you can see from the outside is the optic nerve, the nerve in the back of the eye, and the ophthalmologists were able to see swelling of that nerve, indicating that the whole brain was under pressure. So the first thing we do is an early release operation. It's not so much considered, well, we just said, that's me. See, we've helped his brain quite a bit. Very smart little guy. So the first operation was done in the back of the head. It was not so much intended for any cosmetic effect, but just to start to give the brain a lot more room. So you can basically see what we do is we go in and we're almost connecting the dots. There's a lot of holes there. We're just opening them up, connecting part, and going all the way down into the spine. And the reason for that is that part of the brain is actually now pushing out of the inferior part of the skull, pushing out. It's called a Chiari malformation, where the back of the brain is pushing into the spine. So we open that up in the back, and we moved all these pieces out, and that's done by Dr. Muir and I. John, you can go over.
Sure, so I'll talk about a few things here. So Mark and I work together, and he wants me to stay outside of the brain. He can work around the brain, he keeps me out of the brain. So I'm more responsible for the bones and the reconstruction of the bones. So you can see in this first case, as Mark described, we released the posterior aspect of the skull. And believe it or not, we just set those pieces back in there. So we didn't suture them together or do anything. And that's because we want that brain to be able to expand and grow. So we removed all those pieces. You can see in the parietal area, you see those horizontal cuts, those are called barrel staves. And so that allows those bones to open up kind of like that. And then we took off the posterior parts there and just laid them on. And look what happens. So there he is actually shortly after that first procedure. So even after just doing that, the shape looks better. The brain tries to assume a more normal shape. And actually we also augment this by using helmet therapy. So kids after a procedure like this are in subsequent helmets that help to shape the brain. Here he is a little bit later. So you can see already his head shape is a lot better than it was early on. So the brain kind of seeks its own dimensions. Now the interesting thing to note here is this is by June. And remember how many separate pieces there were. And it's just amazing how good kids are at forming bones. So you can see those segments that three are starting to fuse together, which part of that's good. You want those bones to fuse and you want a solid head, but what's happening is they're fusing so quickly that the brain then gets to the point where it can't expand anymore. So when we started in the back, we wanted to give just more room. So then you wonder, well, what's next? Well, when you take a look at the orbits, especially from the side, you see where the suborbital rim is, that top where the orbit is. Now, I don't know if we have a great picture of this, but what can happen when the bones are restricting growth, particularly in the front, is when you look at us, think about where our eyebrow is compared to our globe, our eyeball. The eyebrow region is usually about 7, 8, 9, 10 millimeters in front of the eye itself, and it provides protection for the eye. But what happens in a case like this is you don't get that scenario, so sometimes the suborbital rim is flush with the orbit, or sometimes the orbit can even be too far in front, and that means that the orbit doesn't have proper protection. Now, next thing that's really interesting is we're now doing something called virtual surgical planning. So with this CT scan, we work with computer engineers to actually do the procedure on the computer first. And you'll see examples of that. So we go through with the engineer, we move the bones, and so we have an idea when we go in the operating room exactly what we're going to do. So I'll show you some examples of this. So this is the CT scan that you saw a few moments ago. Yellow is the skull, purple is the mandible. And this is us telling the computer engineers, okay, draw a line here, we're going to make a cut here. And you can see that the purple part, that's called the frontal bone. We're going to remove that. And then you see those colored bits here on the right side? Those are new bones that we're going to put in there to advance the frontal segment, but you notice that we're advancing it more on the right side than the left. So can you see on the upper right-hand side there, you have the bone grafts there, and it's pushing out that right so much more. And that's because when you look at the pre-surgical photograph, you see the right side, how that right frontal area is so far back. So that the nice thing about this virtual surgical planning is you can try different things. So what I'm showing you here was probably the 5th or 6th try, because I'll tell the computer scientist, okay, do this, take a 2 centimeter piece, put it in there, now move the bone forward. Yeah, I don't really like that, so let's start over again. And you can kind of iteratively go through it and get to what you like. And so there, that's the plan. And you can see it from a different view. And so the plan was for 2 different photographs there. And the reason you need that is to provide support to that frontal area. So if you just move it and don't support it somehow, it'll come right back. Oh, and the other interesting thing is we're now able to also calculate the volume increase. So part of the role and goal of this surgery is to expand the intracranial volume. And so we're now able to model, that was the preoperative volume and postoperative. So we can also make sure that we're doing enough and not too much, actually, because if you push the envelope and expand the skull too much, you have a hard time closing the scalp, and that can cause problems. So normally 75 to 100 cc's is a good amount. If you start getting up to 150, 200 cc's of expansion, you really have a hard time closing the scalp. So here he is after, and you notice even with as much advancement as we had planned, that right area, it came forward a lot, but it's doesn't have a laser on it. But can you see the difference between the left side and the right side? And so here he is, very first picture, and that was after 2 procedures. I think he's really happy with the outcome. All right, thank you very much.
Hi everyone, my name is Noor and I'm a second year MBA student. My greatest honor and my greatest joy to introduce you to Anas and Aser, and today I'm introducing them as a medical student, as a healthcare worker in training, but also as someone who considers them family. I've met them about a year ago, and this is a little snapshot of what their journey has been. And the woman who's sitting right here, the superhero, Gaza, She and I worked on these slides together, and she is someone I truly look up to, and hopefully she gets to understand the Arabic of the slides. شكرا يا تيتا لأنك ساعدتيني على هالموضوع. شكرا يا تيتا. Anas, where is he? Farah? Okay, good. Okay. Anas and Aser. Anas is 14 now, and Aser is 6 years old. Their home was bombed on January 2nd, 2024, and they're the only survivors of their nuclear family. Their parents were killed, their brothers and sisters were killed, and Teta is the mother of Umar. Umar is Anas and Aser's dad, and Grandma quickly became the legal guardian of both kids. This picture is from Gaza, and it's shortly after the bombing. The course of events started with an ambulance that transferred them to Al-Aqsa Hospital in Bir al-Balah, number 3 on the map. And the explosion caused severe burns and damage, which is what actually led to Aser's amputation. After that, he was transferred, actually both boys were transferred to the European hospital in Khan Yunis, number 4 on the map, and they spent about a month and 4 days. A disclaimer on the next slide. Most of you are medical students, but some of you I know come from the public health space, and so if you need to take a moment for yourself and look away, please feel free to do so. Gaza, this was Aser. He was 5 years old at the time. He was amputated and then had to have 2 amputation revisions in Gaza. And these amputations happened with no to minimal anesthesia and minimal pain management. These amputations and the revisions were due to a lack of antibiotics, lack of medication, lack of pain management, lack of anesthesia medication. And as you can see, some of these show some pretty bad infections, and this is due to the lack of sanitation, as you can imagine. You can also see that he had burns on his face, he had a fracture of his arm. And next, this is Anas. Anas was 13 years old at the time, he's 14 now. He had severe 3rd-degree burns covering more than 30% of his total surface body area, and he had complex fractures, some of them were open fractures. And as you can see, his entire right leg, posterior, front, his feet as well, which we'll talk about more. After that, he was transferred, both boys were transferred to Egypt with Grandma as their caregiver. They were transferred to Egypt at Sheikh Zayed Hospital, and they spent a month there. As you can see, Anas looks severely malnourished, cachectic, and he stopped eating after what happened to his family. And hence the decompensation, the muscle wasting, and the cachectic state. This is when they were crossing the border, the Rafah border, and they had to be transferred to Boston via medical airplane because his wounds, Anas's wounds in particular, couldn't sustain a commercial flight. And so this is him getting transferred on the plane. They arrived to Boston the night of March 8th, actually, and the day after Hiba got here. That's in the saying that's in the plane. And I got to meet them the day after. And this is the first time I meet Anas. And you can already see that he's had already 1 round in the OR for a central line placement, which I believe that actually I didn't must have done. Central line placement, as well as a change of dressings and an NG2 placement. This is a heavy slide, but it really doesn't even tell you, it's a minuscule amount of what he has had to go through. And it looks like these diagnoses were easy to make, they're actually really difficult to make. Some of these infections, he's been febrile for about a month and a half without actually knowing what was going on, the underlying causes of his fever. I guess some of the pertinent points to point out here, he came with severe malnutrition at 22 kilos, which is less than the 5th percentile of people in his age. He had open fractures of the left humerus and distal radius. He was found to have candidemia from the old central line, believed to have been placed in Egypt or Gaza. Vancomycin-resistant enterococcus in stool. Wounds were colonized with pan-resistant Klebsiella, pan-resistant Pseudomonas, MRSA. He was later, I think in April, في شهر 4 قالوا له عنده hepatitis. I think in April he was diagnosed with hepatitis, with Hep C, and later was found to have osteomyelitis in the right calcaneus, which was a little bit challenging, I think, for your team to figure out later on. And it goes without saying, PTSD, grief reaction, and poor sleep and anxiety. She's describing the blood infection. I don't know if I can do this. I'm going to fast forward to his treatment and rehab. He had multiple courses of antibiotics due to the severe and multiple infections. He had a total of 9 OR procedures, including dressing changes and central line placements, and 5 graft procedures, which were performed by Dr. Sheridan here and his team. And as you can see, pretty amazing what he was able to do after a few months of being in the inpatient unit at the hospital. And being taken care of, I think, by more than 20 healthcare providers. For Aser, I'm going to let him tell you the story. He's a better historian than I ever could, but he had one orthopedic surgery. And it was a revision in October of 2024. He's gone through rehab, still is, behavioral therapy, therapy by play, and he just started rocking his prosthetic leg last week at school. And this is a video from his early days of rehab. He's a little bit shy, so he's hiding right now. But we'll bring him back. And then next, we're going to move to the people you actually want to hear from. So I'm going to invite, I guess, everybody to come sit. Both of you, Dr. Mira and Dr. Proctor, Dr. Sheridan, Dr. Gorman, Miriam, Tita, Ali, انت كمان موجودة. We're going to start with and a very important person without whom this wouldn't have happened is Dr. Ansari. You know her. You know all about her career in the vibes. What you don't know is that she really does protect us and worries about us like mothers would, and she teaches us and mentors us like teachers do. And I'm very thankful for you for guiding us along the way. And I couldn't think of a better person to moderate this. So thank you.
I would like to invite also Ms. Dua and Jude to come down. So Jude came after Walid, Aser, and Anas to Boston. He came in September with his mother, Ms. Dua al-Arir. He's also an amputee, and he's getting treated by Dr. Sheridan at the Shriners. So 3 patients from Shriners and 1 patient from Boston Children's. But I hope your entire class, all the students know that pediatrics and pediatric surgery and all branches of pediatric surgery are the coolest thing ever. So this is an advertisement for pediatrics as well. So it's my great pleasure today to welcome Walid, Jude, Aser, Anas, and their mothers Hiba and Dua. And they call her Tita Amira because she's the grandmother of Aser and Anas. But actually in age, she's my age. So she started early and I started late. I would like to also welcome 2 of my teachers that became my colleagues, Dr. Rob Sheridan and Dr. Mark Proctor. He was a very young teacher when I did my fellowship. And my friends, Dr. Myra and Dr. Gorman, and of course, Maryam Habibti. This past December, on December 10th, marked 76 years since the adoption of the Universal Declaration of Human Rights. Among the 30 principles, the right to health is a foundational one, particularly relevant in our community of healthcare professionals. To frame our discussion and hopefully your questions, I'd like to begin with a quote from the 7th Secretary General of the United Nations. He's also the recipient of Nobel Peace Prize, Kofi Annan. Kofi said, "There is no trust more sacred than the one the world holds with children. There is no duty more important than ensuring that their rights are respected, that their welfare is protected, that their lives are free from fear and want, and that they can grow up in peace. May all the kids of the world grow up in peace." I also want to share the World Association, Medical Association Declaration of Geneva, which is the modern physician's pledge. Very different from the Hippocratic oath we take, but I think it's worth knowing. I will not permit considerations of age, disease, or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. And these heroes exemplify that. And I'll end with what Maimonides, the Jewish philosopher and physician, said: "May I never see in the patient anything but a fellow creature in pain." So, again, pediatrics. Pediatrics is the right profession. Look at these cuties. So I'm going to start by asking Hiba, because we started with Walid. Hiba, how do you feel today after your journey with Walid for the past several months? كيف بتحسي اليوم بعد رحلتك مع وليد من مارس من السنة اللي فاتت؟ أنا بترجم لك، أنت احكي بالعربي، كيف بتفهموا بالعربي وأنا بترجم لك. احكي لي كيف اليوم، شو إحساسك؟ بسطي لي. Amira is simplifying my question. Tell us about your journey. احكي لنا وأنا بترجم.
أنا مبسوطة كثير إنه وليد الحمد لله قدرنا نعالجه، مع إني أنا كنت يأسانة من قصة علاج وليد بسبب إنه إسرائيل كانت رافضة إنه وليد يطلع يتعالج، بعدين إنه أجت الحرب، إنه أنا حكيت إنه خلاص، بس الحمد لله بفضل ربنا إنه.
She's so happy that despite a lot of challenges that she had getting out of Gaza, that ultimately she was able to come here with the grace of God and get him treated and seeing him looking better.
وبعدين بدي أقدم شكر لهيل بالستاين، وبدي أقدم شكر لمريم قاعدة كولمان، ولدكتور جائد، دكتور ميرا، لكل حد يعني ساعد وليد بعلاج، ولكل شخص تعرف علينا وقدم مساعدة لوليد. يعني لو أنا بدي أحكي شخص كثير فأنا بشكر كل حدا ساعد وليد ووجدنا وليد.
تسلم يا حبيبتي. So she's thanking everyone. I think this doesn't need translation, she's been pointing to them. So she's thanking everyone who worked very hard to bring Walid here, starting with Heal Palestine, one of the NGOs that evacuates patients out of Gaza, and Maryam and Mark Gorman for hosting her, Doctors Myra and Proctor for taking care of her son. And she said if she is to enumerate and say the name of everyone she wants to thank over the past, almost a year, she will take the entire time thanking people. Habibti. Amira. So Amira in Arabic means a princess. And you are our princess. So tell us, احكي لنا كيف حاسة اليوم؟
أهلا وسهلا فيكم جميعا، وأنا مبسوطة اليوم في اجتماعكم وتعرف على شخصيات كثيرة. الحمد لله إحنا مبسوطين اللي تعالجوا الأولاد ولقوا مكان نعالجهم، ونشكر كل اللي وقفوا معنا وجمعية هيل وماما الله يرضى عليها وكل هيلكم وقفتوا معنا وكل هذا يعني ناس كثير قولتها ما بنقدر نعد أسماء من سنة أنا كلهم وقفوا وقفة جامدة معنا الحمد لله رب العالمين اللي ربنا أشفاهم. بالنسبة لأنس أنا بدي أحكي لكم نقطة.
أنس بس الكلمة اللي أنت قلتيها بالأول بعدين نحكي عن أنس. Yeah, the I just wanted to translate. So she's thanking everyone. Again, she's so happy. And she's so pleased by how well her grandkids look right now. And she's thanking so many people, especially, and it's the same thing that Hiba said, thanking God bless Noor, like it's part of the thank you, Allah yahmiha Noor, and all the doctors that took care of the boys, especially Dr. Sheridan. And if she is to thank everyone, she will take the whole hour. So, but then she wants to say something about Aser.
تمام. بالنسبة لأنس احنا قعدنا 36 يوم في المستشفى في خان يونس في غزة. في 34 يوم اجوا الدكاترة عملوا معي اجتماع. أنا فكرت اسمه طلع على المعبر، اللي هم بيقولوا لي نأسف بلغي أهلك وبلغي الناس إنه أنس يجي ياخذوه يتوفى يعني. خلص البكتيريا في الدم عنده صار تسمم وخذوه. لأنه ما كانش ياكل، كان ينتج أخضر، لونه أخضر، بلغم أخضر. ولا ياكل ولا محلول جايب معه ولا أي، هو أصلاً فيش محلول، بقت بنتي الدكتورة تشتغل قبالة في مستشفى الولادة، جابت لي كيس محلول له برضه ما مشاش بجسمه. فقلت لها أنت كان يا رب ده بتقولي له كمان يومين. احكي له.
Thank you. I'm good. I'm not that good. So she started telling us about Anas, the young boy sitting next to Dr. Sheridan. Anas was in the hospital in Khan Yunis in Gaza for 37 days. During that time, he had bacteremia. He became emaciated, as Noor described. And they told the grandmother he's going to die. So there's no transfer. She was expecting a transfer out. There was no transfer. He's dying. تفضل يا أميرة. بعد إيش قالوا لك؟ بعد قالوا لك
قلت لهم انتوا كنا ربنا بتحددوا وقتاش الواحد بده يموت. لو قلت فيش علاج لنا كنتوا راهنين 34 يوم تضربوا فيه. هي معبر الناس بتطلع ليش ما تطلعوا؟ اسمه ما طلعش. قلت لا اسمه يجي 3 مرات طلع، تيجي المديره تقول لي اسمه طلع الصبح تسافري اصبح ما لاقيش اسمه. فيوم ثاني له جاي الاسعاف بقول اسر، قلت وين انس؟ بقول لي انس مشطوب انه مات، قلت هي انا مع السرير. قال يا اخي شقه. قلت غصب عنك بالداخل وشباب كانوا حواليا.
So this is for you, the Palestinian lady. This is my mom. This is my grandma. This is the amazing Amira. So Amira said that they told her he's gonna die. So she kept fighting with them and trying to get his name on the list, and they told her no, he can't be on the list. And then a couple of days later, the ambulance came to take his younger brother to evacuate him. And she asked them, how about the older brother? And they told her, the older brother is dead. And she told them, no, he's not dead, he's there, and you're gonna take him. So, what happened?
فبقول له لا هذا مش موجود اسمه، قلت له انا بدي احمل ولدي، انا ما بعرفش اسوق، في شاب من الشباب تعرف يسوق الاسعاف اذا بدكش اسوق ممنوع. قال يا اخي قلت شو هجم على الشباب؟ قال ممنوع، حيرجعوا المصريين، حيموت من يفضل، قلت لما يموت والمصريين يرجعوه انا حرجع فيه علي.
فانت سقتي
لا بعد انا بعد اسوق كان سنتين زمان وركبت. لما شاف الشباب خذوا مالكش دخل، قال ماليش دخل، حوصلك النقطه وماليش دخل في اسر، في انس. قلت له بس وصلني وين ترجع بديش اشوفك، حرجع ماشي.
Okay, so she told them, if you don't take him, I'm gonna drive the ambulance. Either let her drive the ambulance and she's gonna take him, or they have to take him.
بقول له انا كنت اسمعك اقول لك اذا ميت هان بس يسال المعبر المصري نفسيا حيرجع يصيب 40% بس وصل. انا ماليش دخل، مسكوا الشباب وزفتنا بالاسعاف وركبت، حتى بنت نسيتها بقت بركب مع الناس. قلت له امشي اطلع امشي، يرجعون المصريين حرجع، المصريين شوف لو شفت الباصات كيف استقبلوا محلول ورا محلول، والله انا عشموا الحمد لله، وهذا الحمد لله ده هو عريس في الجيزه وراه.
Excellent. So she said that put him on the truck, and even if he dies on the way, at least we die trying. And then if the Egyptians will return him, at least we tried. So as soon as they got to the Egyptian border, actually the Egyptians took him on, gave him IV fluids, And then he was able to come here, and now he looks like he's ready to get married.
I don't know if you guys could hear them speaking, but it was the cutest thing in the world. So they both don't have a leg. I think probably everyone's realized that. Oh, who wants to speak?
Because I want to do a Quran.
You want to do a Quran? إيش بدك تقرأ?
يلا نحفظ أول امبارح.
Oh, he memorized it just the day before yesterday. Okay. شو بدك تقول يا حبيبي؟
لا بدي أنا أقول لحالي.
بدك تقول لحالك. He wants to tell himself.
القرآن لحالي.
ما هو لحالك ما حدش جاي.
خلص. اوكي حبيبي. معلش اسال انتي دعاء شغله؟
قولي له منه بدي أقرأ.
ترجمي.
Okay, he wants to read Quran. What شو بدك تقول؟ قول له.
يلا سوي.
أعوذ بالله الرحمن الرحيم ومن كان صالحا فإنه يتوب إلى الله فتابا صدق الله.
شو بدك تقول؟ شو بدك تقول؟ فلسطين. طب قولها.
أنا فلسطيني.
أهلا، شرفنا فيكي هون بهارفرد. احكي لنا كيف إحساسك هلا؟ صار لك هون من سبتمبر.
هو الحمد لله أنا إجيت بشهر 10. فرحة ممزوجة بالحزن. أول شيء أنا فقدت زوجي وابني في شهر 11 وشهر 12 وكانت بالمجزرة اللي زرت فيها في مستشفى الشفاء. إني فقدت ابني وفقدت أصابع العشرة وعندي حروق بالغة. وجود فقد رجله الشمال وبرضه كان في حروق. ومع الأسف الشديد كنا في مستشفى الشفاء محاصرين، ما فيش دكاترة ولا كان حتى طاقم لا طاقم طبي ولا تمريض. فجود سقط حالته كانت الرجل مقطوعة من الجزيفة. صارت رجله يطلع منها الدود لأنه ما فيش دكاترة ما فيش رعاية طبية. فمع الأسف يعني حاولوا إنه يلاقوا له دكتور. بعد شهر ونص من إصابته لقينا دكتور. فالحمد لله يعني بدوا معه بالعلاج. بعد شهرين بالضبط من إصابته تم إجراء عملية له في مستشفى الشفاء. وبعدين حصرنا أنا وجود لأنه أنا كنت في مستشفى الشفاء وعيلتي عندي 3 بنات وولد في حي السجعية. اتحصرت أنا وكنت أنا من شهر 12 مبعدة عن أولادي. فكان كتير صعب. أول حصار مع ثاني حصار آخر حصار لما اجتاحوا الشفاء ودمروها بالكامل وطلعونا احنا كمصابين اجباري مشيا على الاقدام برغم اني انا مصابه وابني مصاب وفيش معي حدا يساعدني. لا في جود انا بدي مساعده وبنفس الوقت بدي وجود مساعده. فمع الاسف الشديد اني حاولت اني اتوجه على الشمال عند عيلتي بس اليهود رفضوا تماما اني لازم اروح على الجنوب.
زوجك توفى وابنك بعد ما اجيتي لهون؟
لا قبل.
السنة اللي قبلها.
الجوز استشهد في 3/11/2023 وابني 18/12/2023.
خليني اترجم لهم يا حبيبتي. انا اسفة. So So Dua came through the Palestine Children Relief Fund here to Boston in October. But before she came in October, and just 11 months before, her husband was killed, her son was killed, and then her 3 daughters were separated from her in the north, and she was pushed down to the south with her son because they were both injured, to go to the hospital in the south called the Shifa Hospital. She lost her 5 toes, and her son lost his left leg. And they were at a Shifa hospital for كنتوا بشهر بالشفا ولا أكثر؟ They were there for 4 months until they had a siege around the Shifa hospital. And then the hospital was evacuated, bombed, and they had to leave the hospital while still injured. ومن ابريل لاكتوبر شو عملتوا؟
انا طلعت من مستشفى الشفا على اتجهت على الجنوب، قعدت عند حدا يعني في خيام. صراحة عانيت كثير بما انه عارفة انت في خيام وما فيش لا مي ولا في حمام ولا في بيئة صحية كانت لحالة جود، وانا ضليت مع تواصل مع كذا حدا لانه لازم جود يطلع يتعالج يكمل علاجه برا. فالحمد لله بعد 20 يوم.
So another Palestinian woman for you. So she said that from the evacuation from the hospital, they were in tents, and the tents were not hygienic. So there's no bathroom, there's no place to wash him, clean him, keep the stump of his amputated limb clean. So he started having maggots on the edges of the stump. And she kept calling, asking, reaching out to whichever intermediary that can make her connected to an NGO so that she can come here.
بعد 20 يوم من خروجي على الجنوب تم الحمد لله سافرنا على مصر، وهناك بدأت رحلة علاج جود الحمد لله قعدنا 6 شهور.
So afterwards they went to Egypt and they were treated in Egypt for 6 months. وبعدها اجيتوا لهون.
تواصلوا معنا جمعية BSFR والحمد لله يعني هيئنا 4 شهور والحمد لله جود يعني ركب الطرف وكثير انا مبسوطة برغم انه يعني قديش فقدنا وقديش هيك، لكن الحمد لله يعني انه انا شايفه ابني مبسوط وبيلعب زي باقي الاطفال، والحمد لله صحيح انه كل يوم بيحكي لي وين رجلي وين بابا وين اخويا بضل على غزه. فالحمد لله يعني احنا شعب فلسطين عزيمتنا وايماننا اقوى من كل حاجه. يعني انا بقوي عزيمته بحكي له احنا هيك الشعب الفلسطيني لازم نضحي عشان ايش؟ نضلنا كرامتنا وكل شيء يعني مرفوع، والحمد لله يعني جود معنويات والحمد لله الحمد لله كويسه.
حبيبتي. So Dua is saying that she's very happy. She's been here for 4 months, and in the 4 months she can see that her son now is playing, is happy, is just looking like any other kid. And she loves that. She loves that Dr. Sheridan took care of him. He has a prosthetic now, and he can move and do things that he wouldn't have been able to do back in Gaza. But he asks her every day, where is his leg? And he asks her every day, where is my dad? And she tries to encourage him, where are his sisters? She tries to encourage him and tells him, we have to endure, we have to be steadfast. We call it in Arabic sumud. We have to be tough. This is our lot and we have to deal with it. And all what we want is to have dignity and live a normal life. So Dr. Sheridan was also my teacher, as I mentioned, years ago when I was a pediatric ICU fellow. Dr. Sheridan, you've taken care of Palestinian patients, as far as I remember, since my fellowship. They came with burns, they came with amputation, they came with multiple injuries. And now we have 3 of your beautiful patients. Can you share with us your experience? And they've given their permission.
Well, wow. I thought I was going to be in a classroom with 2 or 3 sleeping medical students. Let's see, where to begin? I work at the Shrine Hospital, which probably most of you have never heard of. It's a small burn unit for kids across town. And we try to basically be everybody's friend, including children's and the MGH and hospitals all over the place. Most of our patients come from New England, mid-Atlantic states, some from further than that. We have quite a few kids that come from outside the United States, maybe, I'm gonna guess 400 a year, something like that. And for reconstruction, for acute care, the philanthropy that funds the hospital funds that care, and that's what has kept me there all these years, because it's really a blast to take care of them. You get some just very complicated, very challenging injuries, and it's really fun to help them. And us and Aser are examples. We got the call. We rely on our relationships with NGOs to facilitate those transfers. We do have funding sources to help with their ambulances. And the hardest part is, I think, the logistics of getting the kids here, especially when they're sick. And we get kids, the military munitions injuries are particularly difficult because they're very high energy, and they often, as in Aser's case especially, associated with a lot of polytrauma, open fractures. Burns is a very cachectic disease. You burn through your soft tissue if you're not very nourished, and he's a perfect example. When he arrived, he was not quite moribund, but almost so. I think the folks in Egypt were probably right. And that brings up that I got to say that the real star of this show is Grandma Mira. She is incredibly tough, loving, resilient, persistent, relentless, and she's somebody you want on your team. I'd be happy to talk, details about, how you do this, but it is really a privilege to get involved in kids like this, where they arrive almost moribund from a lot of different places, and it's not just Gaza. We get kids from Ukraine, from Syria, from all over, Central America, and Afghanistan, Iraq, and it really, I wish the numbers were higher. It's sort of like that, the parable of the starfish at the beach. You do the best you can with, the kids you get to take care of. I don't know what else to say. I'll stop here.
Thank you. So before I take your questions, Anas said that he wanted to say something. So, Anas.
أنا لما كنت بغزة كنت أشوف الناس وهي قاعدة بتموت قدام عيني، وهم قاعدين بتشاهدوا قدام عيني، والنمل قاعد بيطلع وجلدهم أبيض أبيض.
He said that when he was in Gaza, he used to see people getting killed in front of him. And he remembers how they look when they die. They become white, and then they die.
أنا لما انقصر بيتي كنت نايمة على حرام، أنا كان جلدي كله هيك محروق وأنا نايمة على حرام.
When his house was bombed, he was sleeping on the blankets.
فيش فراش، فيش ولا مخدات، فيش طب، فيش ولا حاجة، فيش ولا جهاز ولا حاجة، كله هيك دمروا.
He said all what was left of his house was just the bed and the cover.
لكن نحن كنا على يقين أن الله سبحانه وتعالى سيعوضنا ولن ينسانا.
He said, but he believed that God will never forget him and he will help him.
والحمد لله بعد الدعاء ربنا استجاب لنا.
And thank God, after we prayed, he answered our prayers.
وتعلمنا من يوميتها الصبر، كيف نصبر وكيف نصمد.
And since then, we've learned how to be patient and how to have sumud, steadfastness.
وأنا كنت أسأل عن أهلي كتير ما كانوش بدهم يحكوا لي بس أنا عرفت بطريقتي.
I asked about my parents a lot. They didn't want to tell me what happened to them, but I guessed.
محدش كان بده يحكي لي أصلا إنه أهلي مستشهدين بس أنا عرفت بطريقتي الحمد لله.
No one wanted to tell me that my parents were martyrs, but I knew in my own way.
لكن الحمد لله ربنا عوضنا وهياتنا اجينا على ناس كتير كويسين. ربنا عوضنا بدل غزة الحمد لله وإن شاء الله سنرجع ونعمرها إن شاء الله.
He said, but God replaced the people that passed away with amazing people that I met here, and I'm grateful for them. And hopefully we'll go back to Gaza and build it again.
آسر وين؟
He's asking about his brother. So, who would like to ask a question? Please.
Assalamu alaikum. First of all, thank you everyone who organized this event. I've been working a lot also on the issue of pediatric medical evacuations from Gaza as well, but also with the medical staff in different hospitals in Gaza and the north as well. And I guess I have a question, and this is kind of directed to the clinicians, since we have a student body that's probably a lot of medical students, students of public health. What is our responsibility in the healthcare sector beyond just individually treating a patient? You know, there's so many medical NGOs that go in and treat patients stuff, but what about our advocacy to talk about what's happening? What about our colleagues that are dying and being killed? Maybe some of the surgeons that were treating some of these kids over here, maybe they're not alive at the Al-Aqsa Hospital, European Hospital, at Al-Aqsa Hospital, Al-Shifa, at Kamal Adwan. What about them? And all the medical staff, and what duty do we have to talk about those beyond just treating patients, right? I think it's so beautiful that he talks about wanting to rebuild Gaza, but one of the ethical issues when you evacuate a child is we know that they're never going to be allowed back in. That's the reality of what's happening right now. So what is our duty to be talking about these things?
Thank you. I'm going to translate it to Arabic so the moms would understand. عم بسأل شو مسؤوليتنا إحنا كأطباء هون غير إنه بس نعالجهم، بس نعالج الأطفال. هل إحنا عندنا مسؤولية إنه نحكي عن اللي عم بيصير، عن الدكاترة اللي عم بتقتلوا، عن الأطباء، عن المستشفيات اللي عم تنهدم؟ إذا بتحبوا تجاوبوا أو لكم رأي بليز يعني اللي بدك تقول شيء يا حبيبي؟ Okay. So Anas wants to answer you.
هو لازم إن إحنا ننشر هذه الجرائم في كل أنحاء العالم حتى يعلموا حقيقة هذا العدوان.
خليني أحكي لهم. Okay حبيبي. So he's saying that he would like from us as healthcare people to speak up about what's happening to them, so that, you know, not only them, but all over the world, wherever such things are happening, so that it stops. And so that we know the reality of what other people endure all over the world, and we make it stop. عشان تكون توقف ما هيك حبيبي؟
لأنه إن هذول الشهداء الحمد لله مش ميتين وإحنا عارفين إنه هم مش ميتين. الله سبحانه وتعالى يقول في القرآن الكريم
ولا
تحسبن الذين قتلوا في سبيل الله أمواتا بل أحياء عند ربهم يرزقون. احنا الحمد لله عارفين هم وين اخرتهم وهم وين راح يكونوا ان شاء الله في جنة الفردوس.
حبيبي. Thank you. So he's answering you. I don't know if you understand Arabic. You're a hafiz, I'm a hafiza as well. So he basically recited a verse from Quran, and he said that the people who died, we can't bring them back because they're martyrs and they're now at peace with God. And this is the verse that he said from Quran. And they're happy where they are. But our responsibility is basically for the living, and speaking up would help save the living. Thank you حبيبي, شكرا يا حبيبي.
شكرا لكل نساء غزة الأقوياء قوية، وشكرا لصمودكم، وشكرا إنكم هون، وشكرا إنكم أولادكم عم تعتنوا فيهم، وإنه ملوا كل الغرفة سعادة. I'm just saying that thank you for the women of Gaza for teaching us how to be mothers, and thank you for the children for showing us joy that comes out of pain in Gaza. And I have a reflection on your question. And I think the last 10 years we have seen how armed conflict and war have affected health in ways that are unprecedented. And to answer what should we do as a medical community, I think that we're not doing enough. And I think we should take it upon ourselves to actually continue to speak up against war crimes, crimes against humanity, and genocide. And what is happening in Gaza right now is a genocide that we all need to be speaking up against. And it is a medical issue before anything, and genocide, war crimes, and crimes against humanity are a public health emergency, like we saw here. Remember that in Gaza there are 20 to 30,000 amputees that are very similar to these children, but the difference is that all the hospitals in Gaza are completely destroyed. Not a single one is functioning. Over 1,000 doctors and nurses have been killed, and 450 medical professionals are incarcerated. And Dr. Abu Safiya, one of our colleagues and a personal friend of mine, is incarcerated and not even allowed to see a lawyer until like 2 days ago, and he has been tortured. So it is an emergency, and like he said, that we need to let the world know, and we in the medical community, we cannot be silent, because our oath is to do no harm and to protect life.
Thank you. I would say Anas used a verse from Quran. I'm gonna use a teaching by Prophet Muhammad that I honestly find it always very helpful. He said, whenever we see something negative, something bad, something sad, something evil, we have to change it. As moral people, we have to change it, and we can change it with our hands if we have the power. We can change it with our voice by bringing awareness to it, or we can change it in our heart by refusing to accept that these injustices happening on people throughout the world and in Gaza are okay. So, hadith an Rasul. So, who has another question? Yes, please. We'll start with Abdullah, and Abdullah, then you can give it to your colleague. Yeah.
I was going to ask, first of all, thank you so much for coming to share your stories. يعني أول شيء كنت هذا جيتكم هون وإنه حكيتوا عن الناس قصصكم. It's really impactful. It's really life-changing to hear all of that. I was going to ask, in the case of Walid, right, you had mentioned that you had already done one revision surgery, right, and as you face potentially Walid returning to Gaza, how do you deal with surgical planning and potentially future care where a child is going to continue to grow, and you know that there isn't really healthcare right back in Gaza right now? I mean, how do you deal with, is there a way to future-proof, for lack of a better word, surgeries, and to make sure, and I guess how do you deal with potential surgical care that we will need in the future, and how you might intend for that to happen?
Thankfully for Walid, there's a very good chance he won't need any further surgery. It wasn't a revision surgery, it was a staged surgery, so we had to reconstruct the skull in 2 stages. Our hope would be that he doesn't need further surgery. Obviously, we care for lots of international patients, and that's not always the situation, so it could be very difficult, like how do you send someone back who might need a lifetime of surgery, but thankfully for Walid, we're hopeful that's not the case. Dr. Mir is very happy with the reconstruction. I'm very happy that he's here playing, because without the surgery, the brain would have suffered, he'd be blind, the eyes were already starting to suffer, so he's done fabulously well, which is, for us, all the reward we need, but I think Walid, just for everyone in the room to be reassured, can almost certainly go back home and not need further treatment.
I could just add briefly, it's a perceptive question because it's a huge issue for us, because we take care, the kids are little, they outgrow their result, they need a lot of predictable reconstruction, and so we have invested a lot of money and a lot of time and people in that effort, and we have a whole infrastructure, transport, bringing them back, and most of them are poor kids from poor countries, and so it does require sort of a focused effort, and it's not just kind of random, I hope it works out, but it really requires a lot of planning. It's probably about, of the kids that come from outside the United States for us every year, it's probably at least 50%, 2/3 of the kids are revisions of old results.
I'll just add to what both of them said. It's an excellent question, because whenever you have patients coming from a distance, you have to think about that. So what is the procedure you're doing? What are the implications of that? And what is capable of being done when they go home, wherever that might be? So we definitely think about the type of procedure. Are we doing something that is safe for them to go home? And to answer your question clinically, normally what we do is we see these kids every year just to make sure that they're doing okay. We're going to have an eye exam just to make sure they're not getting edema. So those are some of the things that we're going to think about with him. Mark's right. Hopefully he's not going to need anything in the future, but I do want to make sure that there is some good follow-up. So we'll have to figure that out.
أنا بدي الصراحة أنا النفسية تبعتي لما كانت المحطة كانت سيئة كثير، بس الحمد لله لما الدكتور راكتور والدكتور ميرا ساعدوا ووليد عمل العملية، وبصراحة لما بشوفهم خلص راحة نفسية بتدخل لقلبي، إنهم ساعدوا وليد والحمد لله إنه أنا حملت هذا.
So Hiba is saying that when she left Gaza, she was very despondent, very sad. However, since she came here, every time she sees Dr. Proctor and Dr. Myra, she feels like a weight has lifted off of her, and she's always happy. So I told her, so wherever you go, you want to take them with you.
I wanted to talk to my kids,
بدها إياكي تحكي مع أولاده. You'd be honored.
I just also want to say that Heal Palestine is committed to, Heal Palestine, the organization that helped Walid to come, is committed to following through and trying to do what they can. Of course, the future is a bit unknown, but they are committed to trying to provide his care going forward. Not just his medical care, but also for his emotional care and his education.
And you wanted to?
Yeah, I'll start again by thanking everyone. Sorry I don't speak Arabic, but I wanted to thank everyone for being here. I'm a fourth-year medical student, and from all of medical school, this has been one of the most educational sessions I've had, especially as someone with no background in global health, but going into surgery, I really appreciated it. I had a question about psychiatric care, and was psych care involved in the hospitalization? I mean, considering the amount of trauma these patients have been through. I was tearing up in this session and I didn't live through it. I'm curious how that works at Children's and at these institutions, and then how do we make sure that psychiatric care is also like culturally competent and given international patients, language barrier. I'm just curious about how all that worked.
Thank you. That's the question. Rob, would you like to take it?
It's another great question. It's a very important issue. We do the best we can with the resources we have, and you know, basically all the kids on the unit and their families have been through a huge trauma. We don't, you know, we don't see anyone else. And so those issues, you know, learning about parents, learning about loved ones, all that is very common. Remembering the incident is very common. You know, night terrors are very common. And we have a psychiatrist that works with us, we have psychologists that work with us, all the staff, you know, basically every staff member is a therapist to a certain extent. And I think that's a really important concept to, you know, bake into the program. Could we do better? Absolutely. But I think, you know, you need to get the kids well enough to process, I think, a lot of the time. And sometimes it's just a matter of, you know, trying to, you know, make it bearable with meds up front. Get the wounds closed, get the fractures fixed, and get them nutritionally replete, and then deal with that tail. And I think that I wish I could say we had a very cohesive, excellent program. We don't. We know it's an issue, and we do, I think, an okay job for a burn unit. And love more help.
Thank you. And Mark and John, like I know at Children's we approach patients in every specialty in a multidisciplinary way. So the social worker is part of the team. There is a therapist as part of the team if the patient needed a therapist. But you're absolutely right. Mental health is health, and it's an integral aspect of the kids' care. Thank you so much. So I don't want to go over time. I would like us to give a round of applause for the teachers. Thank you. And a big round of applause for our guests, Dr. Proctor, Dr. Walid. This one's to Mark and Maria. By the way, this is a calendar that is a photographic work of Dr. Barry Levy, who is the world authority on the impact of wars on healthcare. So it's a very special gift. I hope you enjoy it. And then I would like to thank, for sure, Dr. David Jones. And a big thank you for Dean Daly, who's here with us tonight and who allowed us to know. And Dean Daly permitted this event specifically because of the hard work of our students, Noor, Fatma, Abdullah, and Noura. Who has been my partner in every event we do here at the medical school. Ryan, thank you.